What we did in Barbados was to implement the Solihull Approach based on the stuff that we were already doing. We were already doing a lot of parenting courses, facilitation training. So the Solihull Approach became another aspect that we added to a toolbox. And what we did was we worked with many ministries in Barbados: Ministry of Health, Ministry of Education, Attorney General Office. We wanted to embed the Solihull Approach across the country, within schools, the childcare board, within DODS. DODS is like a reform prison for youngsters. So we pulled key professionals from all of those areas because we thought if we did that, we can then train them and then follow up with the trainer of trainers to cascade the training throughout Barbados. And it was an amazing, and that's ongoing because, you know, we're still supporting and following up with a lot of those who did the training.
It was something that hadn't been done before, to have all these cross ministries in one place and to be training. Again, we're talking about shared language. Last year, I was also chairing, I was asked by the Deputy Prime Minister, actually, who is the Minister of Education as well, to chair a panel on inclusive education. And on that panel, 8 of the people who I was able to select were Solihull trained.
Barbados is a small country, so you know that any approval for these kind of courses actually goes to Parliament.
Yes.
It's discussed in Parliament. And so at the ministerial level, they know what's going on and it comes through their approval.
For me, it was the fact that it provided a shared language. I think what drew me to it was that there were so many different approaches within child health at that time, and so many different theories and language. And what I loved was that there was an opportunity for everyone across the different fields, whether it was the NHS, the local authority, social services. Suddenly we had a shared language, and yet you could connect with people on a level which I still to this day don't think a lot of courses are able to do. So for me, it still stands out as having a very solid evidence base to it, but at the same time, it's very connecting and very inclusive.
It's a beautiful way in working with clients, you know, to see the transformation, to see what comes out of the communications. But once you have that shared drive, that shared communication, when we talk about containment, because when you're working with people who are suffering with HIV, you have to work in a specific way. So, you know, we're able to add the whole containment, reciprocity, and also creating containing environment in which people can come into and feel safe to be able to talk about those challenges and those difficulties that can be devastating to, you know, to their lives and families.
One of the things that we are really excited about, and it was something, as I said, that was planned before COVID, was we wanted to have hubs across Africa and also across the Caribbean as well. So next year, October 2024, we are planning a training in Ghana, and we're planning for it to be represented by from 4 different countries. So whilst it will be based in Ghana, the invitations will go out to Nigeria, South Africa, and Kenya.